For the anatomy of the heart, we have superior vena cava, right pulmonary artery, right atrium, right pulmonary veins, fossa ovalis, right atrioventricular valve, tricuspid valve, right ventricle, chordae tendineae, inferior vena cava. And we have left pulmonary artery, aorta, left atrium, left pulmonary veins, pulmonary semilunar valve, left atrioventricular valve, which is bicuspid valve, aortic semilunar valve, left ventricle, intraventricular septum, myocardium, and last one, epicardium, visceral pericardium. So the structure of the blood vessel, which are artery, veins, and capillary. So we talk about artery and vein. Artery and vein have similarities, which is tunica intima, which consists of endothelium, loose connective tissue. But artery have internal elastic lamina, and vein does not have internal elastic lamina. And both blood vessels also have tunica media, which is smooth muscle and elastic fibers. And only the artery have external elastic lamina. And after that, artery and veins both have tunica externa, which is collagen fiber. Then the last one is capillary, which has a basement membrane endothelial cell, and this is the smallest lumen compared to the artery and vein. So we're going into the mechanism of heartbeat. So we should know that the cardiac muscle is a myogenic. So as a node, these parts act as pacemaker and generate electric impulses. Impulses from this part as a node spread across both atria and will cause both atria to contract, and this condition we call it atrial systole. So the impulse from the SA node reach atrioventricular node, which is a node, AV node. At AV node, the impulse are delayed for 0.1 second. The delay is because of it allows both atria to finish contracting and empty completely before the ventricle contract. And the impulse travels through bundle of His to Purkinje fiber. Bundle of His divided into two branches, which are left and right bundle branches. Impulses are conducted toward the heart apex through the bundle branches and Purkinje fiber. Then the impulse spread across both ventricles and will cause these both ventricles to contract simultaneously from the heart apex upward. The blood in the ventricle pumps into the aorta and pulmonary artery. The sequence of events that occur during one complete heartbeat is known as cardiac cycle. Loop sound is produced because of the closing of AV valve, which are tricuspid and bicuspid. Loop sound is produced because of the closing of semilunar valve. So ECG have three normal waves representing the electrical events that stimulate muscle contraction in the heart. The P wave represents atrial depolarization. The QRS complex represents ventricular depolarization and height atrial repolarization. The T wave represents ventricular repolarization. The diseases that related to the heart are coronary artery disease, arrhythmia, heart failure, hypertension, mitral valve prolapse. Coronary artery disease (CAD) is a common type of heart disease. It affects the main blood vessel that supply blood to the heart, called the coronary arteries. In CAD, there is a reduced blood flow to the heart muscle, a buildup of fats, cholesterol, and other substances in and on the artery walls, condition called arteriosclerosis, usually cause coronary artery disease. The buildup, called plaque, make the arteries narrow. So, coronary artery disease often develop over many years. Symptoms are from the lack of blood flow to the heart. They may include chest pain and shortness of breath. A complete blockage of blood flow can cause a heart attack. Treatment for coronary artery disease may include medicine and surgery. Eating a nutritious diet, getting regular exercise, and not smoking can help prevent coronary artery disease and the condition that can cause it. Coronary artery disease also may be called coronary heart disease. So the several symptoms are chest pain that may feel like pressure, tightness, squeezing or aching, pain or discomfort that spread to the shoulder, arm, back, neck, jaw, teeth, and sometimes the upper belly, cold sweats, fatigue, heartburn, nausea. Hypertension. Hypertension is a high blood pressure. Is when the pressure in your blood vessel is too high, which is 130 per 90 mmHg or higher than that. It is common but can be serious if not treated. So people with high blood pressure may not feel any symptoms. The only way to know is to get your blood pressure checked. There are several things that increase the risk of having high blood pressure include older age, genetics, being overweight or obese, not being physically active, high salt diet, drinking too much alcohol. So, lifestyle changes like eating a healthier diet, quitting tobacco, and being more active can help lower blood pressure. Some people may still need to take medicine. Blood pressure is written as two numbers. First, systolic. The number represents the pressure in the blood vessel that when the heart contracts. The second is diastolic. Diastolic is the number refers to the pressure in the vessel when the heart rests. So hypertension is diagnosed if when it is measured on 2 different days. The systolic blood pressure reading on both days is high or same to 130 mmHg, and the diastolic blood pressure readings on both days should be higher or same with 80 mmHg. So, there are several technologies to treat the disease. First of all is a pacemaker. Pacemaker send electrical impulse to help the heart beat at a normal rate and rhythm. The second one is angioplasty. Angioplasty is done to restore coronary artery blood flow. The last one is bypass. Coronary artery bypass surgery creates a new path for blood to flow to the heart. What is pacemaker? Pacemaker is a small battery-powered device that prevents the heart from beating too slowly. You need surgery to get a pacemaker. The device is placed under the skin near the collarbone. A pacemaker also is called a cardiac pacing device. So, why it's done? A pacemaker is used to control or increase the heartbeat. It stimulates the heart as needed to keep it beating regularly. The heart's electrical system typically controls the heartbeat. Electrical signals, called impulses, move through the heart chambers. They tell the heart when to beat. Changes in heart signaling may happen if the heart muscle is damaged. Heart signaling problems also may be caused by changes in genes. before birth or by using certain medicines. You may need a pacemaker if you have a slow or irregular heartbeat that lasts for a long time, that called chronic, or you have heart failure. A pacemaker only works when it sends trouble with the heartbeat. For example, if the heart beats too slowly, the pacemaker sends electrical signal to correct the beat. Some pacemaker can increase the heartbeat as needed, such as during exercise. So today I will explain about angioplasty. So what is angioplasty? Angioplasty is a called balloon angioplasty. It's a procedure that opens the arteries to let the blood go through more easily. So who need to have angioplasty? So people who have coronary artery disease or heart attack may need to have coronary angioplasty. So angioplasty is also used in other parts of the body that have narrow or blocked arteries, such as the neck, arms and legs, kidneys and pelvis. Angioplasty allows more blood to get through the artery that's too narrow or blocked with plaque. This means the organ that artery reaches will get a better supply of blood after angioplasty. So, what does angioplasty treat? So, angioplasty treats arteriosclerosis, which is coronary artery disease, peripheral artery disease, like the major arteries in our arm, legs, and pelvis, and carotid artery disease. If this disease left untreated, they can lead to a stroke. And the last one is angioplasty. Angioplasty can be done to treat chronic kidney disease. So it is mean like when the plaque collects in arteries in our kidney, it affects how much oxygen can reach our kidney.